What if you had a heart attack tonight and did not know it? Not the movie version, not the dramatic collapse, not the hand gripping the chest. I mean the quiet kind, the one that can feel like tiredness, indigestion, shoulder pressure, or a strange night sweat. Large studies have estimated that nearly 45% of heart attacks can be silent or go unrecognized. And after 60, that number becomes more frightening because the warning signs are easier to explain away. You wake up exhausted and call it poor sleep. You feel pressure in your jaw and call it your teeth. You climb into bed and feel short of breath, then blame age, weight, or anxiety, but your body usually whispers before it screams. The problem is that nobody taught you how to hear the whisper. Tonight, I will show you 5 body signs many people ignore before a possible silent heart attack. And the 5th sign is the one people dismiss the most because it only appears when they lie down. That is why it is so dangerous. Because when the heart struggles at night, you may not be awake enough to connect the dots. Now, before fear takes over, listen carefully. This is not about panicking every time you feel tired. It is about recognizing the pattern that separates normal aging from a warning signal. Most people think a heart attack always announces itself with crushing chest pain. That belief is one of the reasons silent heart attacks are missed. A heart attack means part of the heart muscle is not getting enough blood and oxygen. But the pain signal is not always loud, especially in older adults, women, and people with diabetes. Think of it like a smoke alarm with a weak battery. The fire can be real, but the alarm may not scream. It may only chirp, and that chirp may show up as fatigue, sweating, indigestion, breathlessness, or pain far away from the chest. That is the dangerous trick. The heart is in the chest, but the warning can appear in the shoulder, jaw, stomach, back, or even in the way you breathe at bedtime. So the real question is not, do I have chest pain? The better question is, has my body changed in a way I keep explaining away? And pay close attention to this message because you've been asking me for this for a long time and I decided to finally deliver it. I realize that most people don't struggle because they lack information. They struggle because they lack a method. They try everything, mix products, irritate their skin, give up halfway, and then get frustrated because they don't have a clear step-by-step plan. That's why I created the Secret Aesthetics Protocol. In it, I show you the pillars of a complete health and aesthetics method, and reveal the secret techniques the industry doesn't teach you to identify the invisible signs that are aging you. Choose the right and cheap ingredients with the correct order and safe combinations, and build real results from the inside out, with Japanese principles as your big map. And for everyone who follows the channel, I left 3 exclusive bonuses as a gift. It's in the first link in the description or in the pinned comment. Click the link and become part of our community, because this opportunity can go offline at any time. Now back to the video. When a heart attack is silent, it is not always symptom-free. Many times, it is unrecognized because the symptoms do not look like the emergency people expect. They look ordinary. They look like yesterday was stressful. They look like dinner did not digest well. They look like you're simply getting older. But after 60, ordinary symptoms deserve a second look when they arrive, suddenly, repeat, or appear together. Here's why sleep matters. Your heart does not shut off when you sleep. It changes rhythm with your nervous system, your blood pressure, your breathing, and your hormones. In the early morning hours, the body begins preparing to wake up. Blood pressure can rise, stress hormones can increase, and the heart may need to work harder. For many people, this happens without any problem. But if the arteries feeding the heart are already narrowed, that early morning demand can expose the weakness. That is why some cardiac events are more likely in the late night and early morning window. It is not that sleep itself is the enemy. It is that sleep can hide the warning while the body is under a changing internal rhythm. This is also why the signs may appear days before as small changes. The heart may be struggling during simple tasks before it struggles during the night. You may feel it when walking to the bathroom. You may feel it after climbing stairs that used to be easy. You may feel it as a pressure that comes and goes, then disappears just long enough to make you doubt yourself. Now let us reveal the first sign. The first sign is unusual fatigue that feels different from normal tiredness. Everybody gets tired, but this is the kind of tiredness that feels heavy, sudden, and out of proportion. You sleep, but your body wakes up as if it never charged. You make breakfast, and you need to sit down. You walk across the room, and the effort feels larger than the task. Most people call this poor sleep, low energy, or just being over 60. But sometimes fatigue appears when the heart is not pumping as efficiently or when the body is under cardiovascular stress. It can be especially easy to miss because there may be no dramatic pain. The body is not saying, look at the chest. It is saying, I cannot keep up. The clue is change. If your energy has dropped suddenly, if ordinary tasks feel strangely expensive, or if fatigue arrives with sweating, nausea, breathlessness, or pressure, do not dismiss it. The second sign is mild swelling in the ankles or feet that seems harmless. Most people call it salt, heat, sitting too long, or old age. And yes, those things can cause swelling. But when the heart struggles to move blood efficiently, fluid can collect lower in the body. The ankles may look a little puffier at night. Your socks may leave deeper marks. Your shoes may feel tighter even though your weight has not changed much. The sign alone does not mean a heart attack is coming. But when swelling appears with shortness of breath, unusual fatigue, chest pressure, or waking at night gasping, it becomes more serious. This is where people make the biggest mistake. They separate symptoms that should be seen together. They tell the doctor about tiredness one month, swelling another month, and breathlessness later. But the body may be telling one story with 5 different words. If you have already felt the first 2 signs and ignored them, stay with me, because the next sign is one of the most unsettling, and many people blame it on a bad dream. The 3rd sign is cold night sweating without fever. This is not the normal warmth of too many blankets. This is waking up damp, chilled, uneasy, and confused about why your body reacted that way. Most people call it hormones, room temperature, anxiety, or a nightmare. Sometimes they are right. But cold sweat is also one of the classic warning signs that the body is under stress from reduced blood flow to the heart. The important clue is the combination. Cold sweat plus chest pressure, jaw discomfort, nausea, shortness of breath, or sudden weakness is not something to monitor casually. That is not a beauty problem, a sleep problem, or a simple aging problem. That is a reason to seek urgent medical help. Now let us finish the 3rd sign, because this is where people often talk themselves out of acting. They say, I woke up sweating, but the room was warm. They say, I felt uneasy, but I probably had a stressful dream. They say, I was nauseous, but maybe dinner was too heavy. Those explanations can be true. But after 60, the danger is not one symptom by itself. The danger is a cluster that arrives together or returns without a clear reason. Cold sweat with nausea is different from sweating after a warm blanket. Cold sweat with jaw pressure is different from sweating after spicy food. Cold sweat with breathlessness is different from simply waking from a nightmare. When the heart is under stress, the nervous system can react like the body is facing danger. That can produce sweating, nausea, weakness, and a feeling that something is not right. Some people cannot describe it better than that. They just say, I felt wrong. Do not laugh at that signal. Sometimes the body speaks in a language that sounds vague because the danger is internal. The 4th sign is pain, pressure, or heaviness in the jaw, neck, shoulder, arm, back, or upper stomach. Most people call it arthritis. They call it a bad pillow. They call it dental pain. They call it reflux. They call it sleeping in the wrong position. And sometimes that is exactly what it is. But heart-related discomfort can travel because nerves from the heart share pathways with other parts of the body. That means the brain can interpret heart stress as pain somewhere else. This is called referred pain. In everyday language, it means the problem is in one place, but you feel it in another. Here is the pattern to watch. The discomfort may come with exertion, emotion, cold air, or after a heavy meal. It may ease with rest, then return again later. It may feel like pressure more than stabbing pain. It may sit in the left shoulder, but it can also appear in the right arm, neck, jaw, back, or stomach. Do not wait for the pain to become dramatic before you respect it. A quiet warning is still a warning. And if this discomfort comes with sweating, nausea, lightheadedness, or shortness of breath, treat it seriously. The 5th sign is the most ignored and the most dangerous because it often appears when you lie down. It is shortness of breath at bedtime or waking up feeling like you need air. Most people call it anxiety. They call it being out of shape. They call it snoring. They call it getting older. But if you feel more breathless when lying flat, if you need extra pillows to breathe comfortably, or if you wake up suddenly gasping, your heart and lungs may be asking for help. Sometimes this can be related to sleep apnea. Sometimes it can be related to fluid shifts. Sometimes it can be related to heart failure or another cardiac problem. The point is not to diagnose yourself in bed. The point is to stop normalizing a symptom that changes your breathing. Breathing should not become harder simply because the room got quiet. Now let us talk about what to do if you recognize these signs. First, do not drive yourself to the hospital if symptoms are happening now. If you have chest pressure, shortness of breath, sweating, nausea, jaw or arm discomfort, faintness, or a sense of impending danger, call emergency services. Waiting to see if it passes can cost heart muscle. Second, when symptoms are not happening right now but have been repeating, write down the pattern. Write the time, the symptom, how long it lasted, what you were doing and what made it better or worse. This turns a vague complaint into useful evidence. Third, ask your doctor about heart evaluation instead of asking only for sleeping pills, antacids, or pain medicine. Depending on your situation, this may include an electrocardiogram, blood tests, cholesterol and blood sugar checks, blood pressure review, or further cardiac testing. For acute symptoms, doctors often use troponin blood tests to look for heart muscle injury. For ongoing risk, they may look at your history, medications, family history, diabetes status, kidney health, and activity tolerance. The important thing is to stop treating each symptom as a separate nuisance. A silent heart attack is missed because the story is broken into pieces. Fatigue goes in one box, indigestion goes in another, shoulder pain goes in another, night breathing goes in another, but the heart may be the thread connecting them. Now let us correct another dangerous belief. A normal day does not erase a dangerous night. Some people have symptoms in the early morning, feel better by breakfast, and decide it was nothing. That can happen with heart-related symptoms because blood flow problems may come and go. Relief does not always mean safety. It can mean the stress passed temporarily. That is why repeating symptoms deserve attention, even when they disappear. There are also night habits that support the heart, but they are not emergency treatment. Keep heavy meals, alcohol, and intense late activity away from bedtime when possible. Take prescribed medicines exactly as directed, especially for blood pressure, diabetes, cholesterol, or heart disease. Keep a consistent sleep schedule because poor sleep can stress the cardiovascular system. If you snore loudly, wake up choking, or feel exhausted despite sleeping, ask about sleep apnea evaluation. And if swelling or breathlessness is present, do not simply stack pillows for months and pretend the problem is solved. Extra pillows can help you breathe tonight, but they do not explain why breathing became harder. That explanation matters. Now here is the emotional truth. Many people do not ignore heart symptoms because they are careless. They ignore them because they are tired of being afraid. They ignore them because they do not want to bother anyone. They ignore them because they have spent years being told at your age things happen. But there is a difference between accepting aging and surrendering to warning signs. Aging can make the body slower. It should not make you dismiss cold sweat, breathlessness, jaw pressure, unusual fatigue, or swelling that appears with other symptoms. Your body is not trying to scare you. It is trying to get your attention before the whisper becomes a siren. So remember the 5 signs. Unusual fatigue that feels out of proportion. Swelling in the ankles or feet that appears with other changes. Cold nights, sweating without fever, especially with nausea or weakness. Jaw, shoulder, arm, back, neck, or upper stomach pressure that feels unusual. And shortness of breath when lying down or waking up needing air. One of these signs can have many explanations. Several together deserve action. Symptoms happening now deserve emergency care, and symptoms repeating over days deserve a real medical conversation, not a shrug. Because the silent heart attack is not dangerous only because it is silent. It is dangerous because people keep translating the warning into something harmless. They call it age, they call it stress, they call it dinner, they call it the pillow, they call it anxiety, and by the time they realize the body was speaking, the heart may already have paid the price. The goal is not to live afraid of your heartbeat. The goal is to stop ignoring the moments when your body breaks its normal pattern. After 60, wisdom is not pretending nothing is wrong. Wisdom is knowing which signals deserve respect. That decision does not make you weak, dramatic, or difficult. It makes you available for tomorrow. And for the people who still need your voice, your memory, your hands, and your presence, tomorrow matters more than embarrassment. And sometimes, the most important sound your heart makes is not a beat. It is the quiet warning you finally decide to hear. And I want to tell you one more thing. First of all, congratulations for staying until here. If you watched until the end, it's because this topic really matters to you. I guarantee you, very few people stay until the end, and that's exactly why I can't help but recommend the Secret Aesthetics Protocol to you one more time. It's the perfect method for you if you want to reverse visible signs, stop trying everything, and start following a step-by-step plan that works, with the right and cheap ingredients in the correct order, and with safe combinations to improve your skin, hair, and nails from the inside out. When you join, you get lifetime access, and you also receive 3 exclusive bonuses. Click the first link in the description or the pinned comment and start your protocol now. Thank you very much, and see you in the next video.